I played squash at 8 o'clock in the morning. By 9:30 I was home, and all of a sudden I start to sweat and I'm feeling like I have rapid heartbeat, and then all of a sudden the pressure came on my chest and we said, you know what, you got to go to the hospital.
I always considered myself a very healthy person. I was a swimmer, I kayak, I go to the gym, I walk. I started having chest pressure, arm pressure, shortness of breath. The last thing I thought was, I'm having a heart attack.
I was playing paddle tennis with my friends in Greenwich when right in the middle of the point, I had a full cardiac arrest and went down. My friends started CPR on me, the GEMS came, and then they got me to Greenwich Hospital with barely any sinus rhythm and took me right into the cath lab where Dr. House and the crew worked their magic on me.
No one plans for a heart attack. It can happen to anyone at any time. Having access to the best cardiac care here in Greenwich can mean the difference between life and death.
Greenwich prides itself on providing a full array of cardiovascular services to the Greenwich community, from helping patients who have a minor problem, they maybe have some chest discomfort, they just want to make sure it's okay. We can do a stress test and reassure them, to conversely the patient who's having a heart attack and needs to be treated emergently right at that time. We can do an invasive procedure like a heart catheterization, angioplasty, a stent.
Once I arrived at Greenwich Hospital, they immediately gave me an EKG, and very quickly the nurse realized that indeed I was having a heart attack. The next thing you know, I'm getting wheeled into the cath lab.
I was a little afraid, but not terribly afraid. The feeling that I had more so was gratitude. I was grateful that I was there getting the help that I needed.
I was in the cath lab, and believe it or not, I flatlined. And I flatlined for 17 seconds, and then they got my heart going again.
They imaged my heart, found the blockage, removed it, and put stents in the places where it was. But it wasn't an easy job. I arrested 2 more times, apparently, on the table. They told me that I was very lucky to be alive.
It's not like you could predict that that was going to happen. It's not like I had arteries that were closed. I had an incident of plaque breaking off. If Greenwich Hospital didn't have these resources, I wouldn't be doing this right now.
At Greenwich Hospital, we are continuing to grow and expand cardiovascular services. These specialized services include programs for screening, prevention, emergency care, treatment, and rehabilitation. Greenwich Hospital, in affiliation with the Yale New Haven Health Heart and Vascular Center, is one of the few providers in this region to offer emergency angioplasty.
It's so comforting to know that you have Greenwich Hospital as a resource in your backyard, because you never know. And I'm so thankful.
I feel really well today. I've been going to cardiac rehab at Greenwich Hospital twice a week for the past 9 weeks.
The community is very fortunate to have Greenwich Hospital. I never thought I would need this service, but boy was I glad when it was there. Thank you to the doctors, nurses, and staff in the cardio department. Because of your hard work and dedication, I'm able to enjoy my life with my family.
Everybody that works at Greenwich Hospital, you took great care of me and you saved my life. Thank you.
Heart disease is still the #1 cause of death in this country. We've made great strides in improving outcomes, but it's only through the continued investment in technology, physicians, staff, and clinical research that we will have the greatest impact for our community. On behalf of all of our patients with cardiac disease, thank you for your support and thank you for your generosity.